Okay, we'll get started. So good evening, everyone. Welcome to our Next Generation Ambassador Program graduation event. I am so happy that you all could join us or just be present in graduating our second cohort of Next Generation Climate and Health Ambassadors. Our graduating cohort includes 33 young and emerging health professionals aged 35 years and younger, residing across the US, representing 16 states. We have ambassadors studying and practicing allopathic and osteopathic medicine, physical therapy, public health, social work, nursing, pharmacy, and other health sciences. We launched our second cohort in January of this year. Since then, ambassadors have attended skills and topical trainings in climate and health and have participated in monthly PSR-directed advocacy actions and local climate and health adaptation and mitigation projects. They've also attended all ambassador networking meetings, and some have even lobbied on Capitol Hill. Our training topics included the health harms of gas stoves, how to write an effective public comment, an LTE and op-ed writing workshop, an environmental justice roundtable, and most recently, a climate and health opportunities fair. I want to thank all of our ambassadors. Some of them are not here tonight, but all of them who have remained enthusiastic, driven, and flexible throughout the entirety of this program as we have tried out the very first semester long approach. You never cease to inspire and amaze me with your ongoing advocacy work and dedication to making the planet greener and more healthy for all amidst your incredibly busy schedules. I have been truly impressed by the creativity and breadth of your local projects and advocacy work, and it has been wonderful to witness the teamwork and community between you all that has materialized and strengthened throughout the program. I also want to thank all of the PSR national staff, board members, chapter leaders, and all of you here today for helping out and contributing to the program in various ways. I'm looking forward to continued collaboration between our graduating Next Gen ambassadors, our upcoming cohort, and the rest of the PSR community. I'm so excited to see where you all go in your journeys as climate and environmental justice advocates and healthcare professionals. We are so happy to welcome you to the PSR community, and we hope that you continue taking an active part in our organization. Now I'm going to hand it over to Barb Gottlieb, our Director of Environment and Health, for some remarks.
Thanks, Becca. And good evening, everybody. I'm just absolutely thrilled to see you and so happy that I could be with you tonight. I'm Barb Gottlieb. I'm the Director of PSR's National Environment and Health Program. And on behalf of all of us at PSR, I'm just so pleased to congratulate all of you newly graduating Next Generation Ambassadors. Part of my role here at PSR is to conceptualize, to develop, and then also to find the funding for programs around the country that concretely slow climate change. Our programs in PSR fight fracking, reduce the demand for fracked gas, promote the uptake of clean, healthy, renewable energy, build support for health protective and climate protective federal policy, and also engage health professionals in these and related topics. So part of my role in the past was conceptualizing and launching what became the Next Generation Ambassadors, you guys. I first proposed that program back in about 2020. We secured funding in 2021. And since that time, and very much with the assistance of Becca Phillips, the program has moved from intention to reality, from a concept to a well-defined program with clear objectives, a plan of action, and graduates. So I, like PSR, am all about making things happen that actually change the world. And that's why I am so impressed with the work that you guys have done as Next Generation Ambassadors, especially the projects that you have created and or participated in. We're going to hear about a number of them tonight, but I just want to share a few words about a few of them, and maybe you'll hear more about these very projects later. Several ambassadors, several among you, helped design and promote climate and health curriculum at their medical schools or at their universities, increasing the opportunities for your peers to learn about and respond to the climate crisis. One ambassador took a very direct approach to educating about climate change, creating an educational YouTube video for young people talking about climate anxiety and giving them tips about how to deal with it, how to navigate it. Another took action to improve an existing climate education campaign by assessing the efficacy of a patient education campaign that oriented pregnant women on mitigating their exposure to extreme heat while they were pregnant. Some of you all have worked with the PSR chapters around the country. One example of this is several ambassadors worked with the Washington State PSR chapter, where they helped to create an awareness campaign around the benefits of home weatherization and how.
Oh, you cut out, Barb. You're muted.
There we go. Thank you for letting me know.
Oh, you're muted again. Oh, there we go. Okay, perfect.
Okay, wow. Thank you. Some of you addressed environmental justice issues, like the project to develop an environmental health and justice mini workshop series to be presented in a science classroom in a high school in Columbus, Ohio. And some of you actually delved into the realm of climate policy, like the ambassador who worked with the Safe Water Campaign in Portland, Maine, conducting data and policy analysis and working with experts and scientists to provide strong evidence for advocacy efforts. These projects they're practical, they're amazing, they're tremendously varied, and they are designed to create impact in the world. I'm thrilled to learn about them. I'm proud to have played a small part in the program that allowed them to happen. But what I really want to do now is pass the mic back to the stars of tonight's show, you guys, the climate ambassadors.
Thanks, Barb. I really appreciate it. And I'm excited to hear about all of your projects and just your reflections as ambassadors. So I'm just going to explain what is going to happen next. So we do have a speaker order, which I'll post in the chat so everyone is prepared. So each of you will have a minute and a half. I will write in the chat when you have 30 seconds left, so you can keep on pace. If you'd like to share your screen to show a work product, you may do so. I too do encourage everyone to comment in the chat. You can put emojis and celebrate everyone, or just put any comments you have. And then at the end, if we have a little bit extra time, we can have a little Q&A session if you all want to ask each other questions about some of the projects that you have done or just your reflections as ambassadors. So let me just put the order in the chat again. Give me 1 second, and then we will get started. One second. And Cameron, you're going to be last, as I told you. And I will be introducing everyone. So I hope I get all of your names correctly pronounced. So here's the order for everyone. Okay, so first off, we have Damilola Uluwamimo, who is an MPH student at Western Illinois University. Damilola, all yours.
Hello, everyone. Just like she introduced, my name is Damilola Uluwamimo. I'm originally from Nigeria. I'm an international student at Western Illinois University, and I'm studying for my MPH program. So I'm really so glad and opportune to be part of PSR Next Gen Leaders program. And this program has really equipped me to take part in so many advocacies in climate change and health. I have, during the course of this program, I've been able to organize some climate and health education program for students in my school district. I've also, the project that I enjoyed the most was the EPA advocacy paper that we had to write. I had an opportunity to share my story, which was very important to me. And lastly, during the course of this program, I've been able to present a research paper at the Illinois Public Health Association, and it was also an exciting project for me. And finally, on my own personal projects that I had to do for the course of the program was creating a climate and health curriculum. And presently it is being reviewed in my school for other public health students. So I'm really excited about that. So I'm really happy to be part of this event and the program generally. I thank Becca and all the staff and everybody at PSR for making this program very good. And I'll be able to use the tools and the resources that I got from this program. Thank you.
Thank you so much. And I know it's always hard to go first, but I really appreciate you going first, Damilola. Next up, we have Frank Satrial, who is a resident physician in family and community medicine in Harrisburg, Pennsylvania.
All right, thanks, Becca. My name's Frank. As Becca said, first-year resident at Hershey Medical Center. I really appreciated being a part of this program. First time for me getting into advocacy actions, making comments, and writing letters for important policy that we'll need in the future. For my own work, it's piggybacked off of something I did for the American Academy of Family Physicians in their leadership program last year. It was a website with climate and health related information for both clinicians and patients. I'm going to put that in the chat for anyone who wants to look at it, c4climate.org. And for the project that is continuing that work, we had one of our team members present earlier in the year at a Geisel School of Medicine at Dartmouth sponsored conference in Vermont, presenting user data. And then going from there, we're building a survey to understand how patients and providers benefit or can get information from that. And then also assessing their comfort with discussing that type of information. So we're excited to see where that goes. Thanks.
Thanks, Frank, and thanks for sharing that link. I'm looking forward to seeing where your project goes as well. Next up, we have Daniela Morales, who works in public health research and consulting and currently resides in Portland, Maine.
Thanks so much, Becca. As Becca mentioned, my name is Daniela Morales. I work in public health consulting for a company based out of Boston, but currently living in Portland, Maine. And for my project, I actually worked for an organization called Defend Our Health, which is based out of Portland. They work primarily in toxics and plastics policy, but one of their main priorities in the state of Maine is PFAS work. So I did a lot of background research and writing for some of the PFAS legislation that was being proposed during this legislative cycle. So I was really able to engage myself and in the work, and we were able to pass a few PFAS legislations, including an act to ensure access to safe drinking water for household wells in rural areas, as well as making sure that landlords are testing water for PFAS in residential areas as well. So it was really a wonderful opportunity to just be able to engage with this organization in such a deep and concrete way. And I think without, the support of PSR in, writing and in engaging in some of this advocacy work, I wouldn't have been able to engage as deeply as I have. So I just want to thank the organization for setting up such a wonderful opportunity for us all, and yeah, it's been wonderful, so thank you.
Thanks so much, Daniela, and great work. So next up, we have Effie Akam, who is taking part in a minority health policy fellowship at Harvard University in Boston, and was recently the chief resident physician in internal medicine and pediatrics at MGH in Boston.
Thank you so much, Becca, and hi, everyone. So I want to talk a little bit about my project, which I did with 3 other ambassadors who are not on here, so I get to talk about it more. We got together to plan an advocacy day in Massachusetts State House around 4 different climate policies that are endorsed by a lot of the different climate advocacy organizations in the Massachusetts area. And so we chose 4, and I'm actually going to put it in the chat. We chose 4 bills that were legislative priorities to endorse. We were able to connect with so many different people across Massachusetts, not only in formal environmental advocacy groups like the Environmental League of Massachusetts, but also different physician groups, different medical student groups, came together, put together a team, and we're going to be actually at the State House next week advocating directly with all of our legislators. And I think that the best part was really just forming a network for future advocacy work, because now we have a lot of people we can turn to really build coalition and build power if we want to do more advocacy events, including protests or other things like that. And so you can see some of the bills there if you're interested on the website. And I just want to thank everybody, thank my team, thank Barbara and Becca for all their work. And I'm excited to hear about all your projects.
Thanks, Effie. And I do want to say, is it what next Wednesday is the Climate and Health Day at the Massachusetts State House?
That's right.
Yeah. So if you do live in Massachusetts, great opportunity. I'm unfortunately away, but I'm really excited about it. Thanks so much. So next up, we have Kelsey Barter, who is pursuing residency training in child neurology in Nashville, Tennessee.
Hi, I'm Kelsey. I just graduated from medical school at Vanderbilt, and the project that I've been working on, I was actually just going to share my screen, but we've been working on a climate and health curriculum.
You can share your screen. You can just
Okay.
take a second. Sure.
Here we go. So this is the very large Google Doc that we've been working on, and I'm not the only person that has contributed to this, but this was kind of something that I really wanted to get started and have a final draft of before I graduated from medical school last month. But credit to everyone else who's also contributed to this. And what we did, so this is kind of the overview of the curriculum proposal. So everyone that was working on it is a current medical student at Vanderbilt, or like I was until last month. And then we, kind of keeping in mind the curriculum at our school, made proposals for specific lectures to be implemented in all the different phases of the curriculum. And we used a lot of existing materials from Climate Resources for Health Education and the Planetary Health Report Card. But what we did for each lecture we proposed is provided learning objectives, readings, related lectures that already existed in the curriculum, and then suggested faculty and listed what has been done at other institutions, and have given this to the administration, and it's generally been really well received. And so it's going to start being implemented in the next school year. And I think that I'm probably close to done on my time, but I just want to say thank you to everybody. And Becca, these trainings, especially the ones on particulate matter and gas stoves, have been really interesting to me to kind of get more knowledge behind some of the issues that I care about advocating for, and I think are going to be really applicable in my new job as a pediatrician starting in a couple of weeks. So this has been a wonderful experience. Thank you.
That's awesome, and congrats on the new job. And that's wonderful work. It's great to see all the climate and health curriculum coming together. Next up, we have Alex Holland, who is a social worker in Dallas and prospective PhD candidate. I know you're going to be moving to Galveston, Texas soon to pursue your PhD.
Good evening, everyone. Yeah, like Becca said, I'll be moving to Galveston pretty soon to study climate change and public health at UT Medical Branch. So I'm very excited for that and want to thank PSR for the opportunity to participate in this program. I'll get a little bit into my project in just a second, but I really feel more prepared than I did when I first got accepted to start this program. So thank you for that. So for those of you who probably don't know, I am in Dallas. I work for a medical school / hospital system here in Dallas. And my project was creating a group of healthcare professionals to be used as an advocacy opportunity for local environmental justice organizations. Before starting with PSR, I was working with local EJ communities, and they had mentioned wanting physicians that they could reach out to speak on some of these issues that they were facing, and there were no physicians that they felt like they could reach out to. Well, with this project, I was able to create a group and actually gained a lot of interest from other physicians and health professionals, including other social workers that I work with. So it turns out there were a lot of physicians. There's just no cohesive, organized group to be able to access. And come to find out, herding busy physicians feels a lot like herding cats. But I'm happy to report that the group has been formed, and even though I'm moving, there are other physicians who have offered to take it over, so it will be sustainable after I have departed. But thank you so much to PSR for organizing this. I've learned a lot about political will, both local activism, community organization, as well as national policy implementation, lobbying. Being able to meet some of you in DC was incredible. And I'm really looking forward to continuing these friendships that we've formed and the networking opportunities that we have. And also congrats, Kelsey, and on the job. Awesome.
Thanks so much, Alex. Yeah, I also wanted to congratulate everyone who's also graduated or starting new jobs or just still going through medical school or other health sciences school. It's hard and but very rewarding. Next up, we have Anna Fry, who is a public health student at New York University, but lives in Los Angeles and works in public health.
Thanks, Becca. Yeah, so as Becca said, I'm going into my second year at New York University as a global public health student. My focus is on the Sustainable Development Goals, and I'm definitely keenly interested in climate change. So this whole program has been a really great way to jumpstart more involvement for me personally and professionally in the climate change space. And huge thanks to Becca and PSR for giving us this opportunity. It's been really awesome. So for my project, I partnered with an organization out of Uganda called the Uganda National Academy of the Sciences. I can throw their website into our chat if anyone wants to check it out. But their focus is building a more equitable society within Uganda across really a variety of different sectors and different topics. They have a climate change up and coming sector, and what they wanted to start out with was putting together a report that's focused on community action for climate change. They release 1 to 2 reports a year, and the intent of the reports is help to guide their government and guide policy decisions around whatever the topic is. So the last one that they did was around equity and inclusion. They did one on pandemic preparedness, and then this one was on climate change. I can't show you the report so far, and it should be released later this summer. We're working on the final draft now, and it should be almost completed by mid-July. But some of the topics we're really looking at the barriers to community ownership of Uganda's climate action, how to implement successful and equitable climate mitigation strategies, and how to really partner with local communities and local cultures to come up with climate change strategies that fit in the context of the culture. So that's the super high level overview, but thanks again, and thanks for the time today.
Thanks so much, Anna. And also, I know it's hard to condense a months-long or years-long project into a minute or a minute and a half, so I appreciate the brevity. Next up, we have Jeffrey Blackman, who is a medical student at the University of Maryland in Baltimore.
Thank you. I had the pleasure of collaborating with the great Dr. Alex Terbosia-Gast. She unfortunately couldn't make it tonight due to travel, but it was an absolute joy getting to work with her. Together, we hosted the first independently coordinated climate action party using the app Climate Action Now. Thank you so much to all of the ambassadors and folks at PSR who joined us at our party, and special thanks to Alex Holland for introducing us to the app. This project really couldn't have happened without our partners at the app, founder and CEO Brett Walter and tech guru extraordinaire Matthew Vollrath. Alex and I reached out through our networks, recruited speakers, and were lucky enough to have the dazzling Zach Williams MC our party. We drafted about a dozen actions, some recommended by our speakers, others pulled from previous action parties, and some that we just thought up. Ultimately, over the course of an hour, our party goers completed over 500 actions. And getting to actually take action and help others do so as well was really meaningful. And before taking on this project, the impending climate catastrophe felt too enormous, but now I feel like if we take collective action, we actually stand a chance.
Thanks so much, Jeffrey. And it was really a lot of fun. So thank you so much for putting that together last week. Next up, we have Morgan Roberts, who recently graduated with an MPH, or is she here? I don't know. Maybe she, oh yes, okay, good. I just want to make sure you make, who recently graduated with an MPH from NYU in Global Public Health.
Hi, thanks, Becca. And I've really enjoyed listening to everyone's presentation so far. So I, along with another member on this call, was able to participate in a research study that we're still working on right now. I was the project manager and also on several projects for the Applied Global Public Health Initiative, which is a student-run lab at NYU that has partnerships all over the world. And one of these projects specifically was on food-related insecurity due to climate change in southern Madagascar. And so we have in the Android region of Madagascar a partnership that we've been working with. They're currently doing focus groups to gain insights on like present and future implications of climate change with different groups there in the region. So our team first started out with a literature review, and then I later joined on the project to help with the qualitative study that's going on right now. And this semester we were able to secure some more partnerships in the region, as well as get a grant. And so we worked a lot on our grant proposal, and it was a really exciting opportunity that will hopefully influence how climate change is affecting the most vulnerable populations in the world. So that was kind of my project. And then I also been working with Zach Williams to create a landlord advocacy document for how landlords can then like be persuaded to change from gas stoves to electric stoves. So that's going to be published by PSR, but currently in the works. So that was kind of like my more localized project that I was excited about. So yeah, those are just a few things I worked on, and really grateful for hearing about all of your experiences. I feel like it's just really humbling to be with such an intelligent group. So thank you.
Definitely. Awesome work, Morgan. And I can't believe you did all those different projects. I'm excited about the collaboration, and that some of you are using gas stoves in your work, and that AGPHI has been a great collaboration with PSR. So thank you so much. Next up, we have Alexis Domoraki, who is a medical student at Duke University in North Carolina.
Hi, everyone. So I'm really excited to be here, excited to celebrate with y'all. I think the big takeaways that I want to talk about is, one, just appreciating how interdisciplinary this work is, and having all of us here together sharing all of our different perspectives and opinions and expertise has really reiterated how important it is, how instrumental it is really to have everybody on this fight together. And it's easy to get pigeonholed in med school. I mean, we talk about interdisciplinary all the time, and we don't actually ever put it into practice. And being here with y'all at once a month, just reminding me, okay, we have like a lot of people in this fight with a lot of different skill sets, and I'm really appreciative of that. And another thing that I'm grateful for is just the empowerment to do more advocacy. I felt like I've done small acts here and there, more on a very local scale, and this has been able to reinforce how important it is to use your voice, and how you do have a say in what happens, and your voice does matter, and your perspective matters, no matter what stage of training you are, no matter where you are in the world. So I'm just really grateful for all these lessons, taking it away.
Awesome. Thanks so much, Alexis. And I appreciate those reflections. It's been great to see just a diverse group of people come together and really build solidarity. Next up, we have Audrey Wong, who is a pharmacist in South Bend, Indiana.
Hi, everyone. My name is Audrey. Sorry, I'm a little bit sick, but I have been really enjoyed this program. I think that it has been always so inspiring to just like hear everyone's actions every time we have a meeting. But for my project, I have been working a lot with my organization, with other organizations that we are pushing for this resolutions on climate change and health at the World Health Assembly. This year, we are just focusing a lot on like bringing health, maybe like emphasizing a little bit more than just saying that we're going to have a health day at the COP conference. So it is very exciting to see a lot of like youth initiatives during the World Health Assembly. So for example, we have been working a lot with the resolution. We got to talk to a lot of different member states during that time. But at the same time, we also got a lot of more youth to actually deliver a statement emphasizing the importance of climate change and health. So I'm just really excited to see how this is going to go and how we can actually shape this Health Day at COP.
Great work. I'm excited to see how the resolution shapes up, and awesome job. Next up, we have Chandani Thakur, who is an osteopathic medical student in Mesa, Arizona.
Hi, everyone. This is Chandani. I was throughout this past semester working with a local organization called the Siwa Patli Collective, and they serve local urban indigenous groups in a whole myriad of ways. One of the branches that they have is a food forest, and so they really put a focus on sustainably farming crops that are also pertaining to their own culture and a lot of the foods that they incorporate into traditional recipes. And so another branch that they have is for reproductive birth equity rights. And so what I did was I partnered with the people working on both those branches and put in a lot of research to see what crops they could grow that fit in with their traditional recipes and also was nutritionally like helpful and sort of supportive to pregnant and postpartum patients that they were serving as well. And so through them, I was able to also organize opportunities with their doula program, and I was really grateful to learn about their cultural community because I had never really been exposed to this group. I also thought that the opportunities that PSR gave me through lobbying in DC and learning more about gas stoves since I was located in Arizona with all the legislation that was going on. I was exposed to so much that I never would have been without this program and wouldn't have thought I was capable of it this early on in my career since I just finished my first year in medical school. So I'm really grateful for those opportunities. I think everyone in this program is so lovely to work with. So I'm grateful for this opportunity.
Thanks, Chandani. And that was such a unique project. Do you want to post the link to the collective in the chat just so other people can view it if they have a website? Awesome. All right. Next up, we have Marique Patel, who is an MPH student with a focus in epidemiology at New York University.
Hi, everyone. I'm glad to be here. And I work on a project with two of the engineers who use 3D printing to get the basically make a sustainable products. So we use some plastics to make into sustainable products like mobile cover or pencil stand, basically a pen stand or something. And like in the future, we'll be still working on it. And I am also currently interning in a NYC health department, environment health department, and we are working on hazardous material, how we can regulate it more. So I'm working on it, and I want to thank you, Becca, for all your emails and newsletter and how we can make a change by advocacy action. So I'm thankful to you, and it was great learning from every other and hearing from you all guys. So thank you.
Thank you so much, Marique. Great work. Next up, we have Marisa Guerrero, who is an MPH student with a focus in climate change and health at New York University in New York City.
Thank you, Becca, and hi, everyone. So like Becca said, my name's Marisa. I'm in an MPH program at NYU, and my focus going into my MPH was this intersection between climate, health, and public policy. So I was really excited for this opportunity to really dive into those topics in this fellowship. So for my project, I worked on a New York State level bill called the Stop Climate Polluter Handouts Act. So for some background, New York right now is spending about $1.6 billion every year subsidizing and providing tax incentives for the fossil fuel industry, which really sends the wrong message that we support this industry that is not only destroying the planet, but also enormously profiting off of that destruction. So the bill that I'm working on would eliminate many of those subsidies. And sorry if I sound like a broken record, because I think you've all heard me talk about this before. So for the project, I worked on a coalition with an organization that I had been working with prior to starting my MPH. I led coalition calls, we worked on campaign strategy, we lobbied legislators, I created some written materials, so a lot of different policy related actions. Unfortunately, the bill did not pass this session, but we did build a lot of momentum, and I think things look pretty promising looking towards next year. And I think that all in all, the fellowship was such a great way to be able to dive into these interests that I have in policy and climate and health, while also working alongside all of you. And I've just been so impressed by how passionate and creative all of you have been. So thank you all, and shout out to Becca for being our fearless leader over these past 6 months. It's been really great working with you.
Oh, thank you. I really feel like it was a collaboration. Great job, Marisa. And I want to also thank a few of the ambassadors. Thank Marisa, Melissa, and Alex for also constantly sending me different actions and bills for you all to take part in. So it really has been a collaboration, and I really appreciate it. Next up, we have Brianna Van Noy, who is a medical student with an MPH in Columbus, Ohio.
Hey everyone. I guess in terms of reflections, this has been a really great opportunity to kind of connect back to my environmental health roots. I did my MPH before medical school, and as a medical student, you can feel disconnected sometimes to other causes that are really important to you. And so this program has been really nice to get refreshers on some of those topics that I had forgotten about, and just critically think about some of these issues again. And also to connect with all of you. I think it's been really awesome to be in a community of like-minded health professionals and know that we're all kind of on the front lines together. And so I'm excited about our future careers and hoping to connect across our given fields on some of these issues. In terms of the project, I had the pleasure of working with Alexis this year in hopes of building a mini workshop series on environmental justice, specifically for high school students. This is a lofty goal considering Alexis was doing field work in Nicaragua, correct? And then I was studying for step 1. But we did make some good strides towards our goal. So we were able to develop an outreach and education subcommittee within the Sustainability and Medicine group at Ohio State, which is really great because now I have a team of medical students that will be helping us actually deliver these workshops. Alexis and I have had several meetings talking about our workshop design. Our first introductory lecture will just be related to environmental and climate change intro for high school students. And then we hope to do a couple workshops on ozone and heat, air, water pollution. And so exciting, Alexis found an additional fellowship opportunity that we're planning to apply to this month to continue this work. It's a climate health fellowship program through Harvard University. So we're hoping to keep the momentum that we've gained from PSR and continue on with this project. So thank you to everyone for all of your efforts. Thank you to Becca for all of your work with this program, and it's been a pleasure.
Thank you so much, Brianna. I really appreciate, and Alexis, for your work. And I'm excited to see where your project continues to go. And congrats on doing step 1. That's a lot. All right, next up we have Amanda Dalmida, who is a family medicine resident in Los Angeles, California.
First of all, Becca, thank you so much for organizing this.
Amanda, it's a little hard to hear you.
Oh, okay.
That's better. That's better. Yeah.
Let's see, hold on. Can you hear me now?
Yeah, just speak up. Speak up.
Okay. Becca, thank you so much for organizing this. It's been really helpful learning how to get trained in like op-eds and all of that, especially all the advocacy actions that we could do in a timely fashion with like how busy our schedules are. And also y'all are so amazing. It's awesome hearing everyone's like reflections and projects. So I had a couple of things that I worked on. One of them, I've been working with the Food Fix campaign, which is a campaign through Washington, D.C., and we focus on increasing regenerative ag and advocating for food as medicine at the national level. I produced a video about the Farm Bill. It's kind of like a 101, but I've been working on videos with them for the past couple of years, so I can send a link to the videos that I've worked on in the past. And then I also went to the Bay Area and created content for the Deep Medicine Circle. And they aim to heal the wounds of colonialism through food, medicine, story, restoration, and learning. They're aiming to advance a food system based in care. So they have a 38-acre farm in Ramaytush territory in San Gregorio, California. So I conducted interviews with like the farmers and the folks that work there, and edited some videos to help weave the story of farming as medicine. Including like how farming practices can decrease pollution, increase CO2 sequestration, and the impact of human and environmental health. So that was really cool to see their farm, and they're doing really great work up there. So I'll put the links in the chat.
Great work. Thank you so much. And you also work with another ambassador, Rebecca Kwan, on homelessness resilience project. So thanks so much for your outstanding work. All right, next we have Melissa Sullivan, who is a registered nurse in community health in Philadelphia, Pennsylvania.
Hey there, everyone. First, just like everyone else, I want to thank Becca for just how awesome of an opportunity this has been to learn so much and get new exposure to things like op-eds and writing. Writing the public comment, I think, was one of my favorite of the advocacy actions. So throughout this time, I think I've been just most heartened to see how through our collective action and through all the amazing work that people are doing, we can do so much, even if it, like everyone's saying, doing an hour here, an hour there of small things really builds up into really cool work. So throughout the last few months, I've gotten to connect with old coworkers at Mass General doing kind of a plant-based eating challenge. I've gotten connected with Penn Park Farm, who does work with food insecurity with students and staff members, and have designed education modules for students in an upcoming class there about the impacts of sustainable agriculture and food on human health and on mental health. I have also gotten to do with the patients at the clinic that I work at, advocacy and outreach with all the wildfire smoke that we've had recently in Philly and New York. In the last few weeks, getting to reach out to all of our patients with respiratory illnesses. And then the biggest project I've been really excited about is starting a small community garden at my farm that we're able to integrate into our nutrition classes with clients so they can see not only the impacts of healthy eating, but also of sustainable eating, and hopefully starting their own gardens in their homes. And I think that not only has it been amazing to see the small changes in their physical health that is coming from the garden and from nutrition classes, but also just how much community you can build around kind of passion like this, around gardening, and how much it brings people together. So it's been really awesome to get to learn and grow with you all, and I'm excited to keep hearing about all the cool work everyone does. So thank you.
That's awesome, Melissa. Thank you so much for all of your work. And I know that you ended up doing a few different projects, so that's awesome. All right, last up, we have Cameron Grund, who is a nursing student in Minneapolis, Minnesota.
Hi, folks. I am just want to say very thankful, and I feel so inspired listening to all of your projects and all of the work that you did. It really is I think someone said before, it's very validating to know there's other people who are interested in healthcare, and then also how to make the world and ecosystems a better place to be. For my project, myself and Mira we created the video about climate anxiety, and it was really interesting to find out that there wasn't a lot of evidence-based resources available. And so I think it kind of is inspiring me to like create more evidence-based or to look into more evidence-based resources and to just continue learning about climate change and how mental health is so intertwined with that, and especially with the community sense of that. And so, yeah, I posted the video and we'll see how it goes. And I'm just very thankful again. And thank you for this opportunity, Becca.
Thank you so much. Wait, do you have a link to the video, or can you post
Yeah,
it?
I do. Yeah. Thank you.
Yeah, I would love to view it. Well, awesome work, everyone. It's so awesome to see just the breadth and the diversity of everyone's projects, but also how interconnected a lot of them are. And so great to see all the teamwork between ambassadors and all the collaborative and shared projects as well. I think we have, if anybody wants to ask a question or two of anybody else about their projects, we can do that. Someone asked a really good question. I'm going to make sure that the Slack is up and running, or at least I'll have a directory so everyone can keep in contact. I know that a lot of you are continuing to do different projects that you are still working on, or might just want the chance to collaborate. So I will make sure that everyone is connected. Does anybody want to ask any questions of each other? If not, we're going to have Barb talk about some other opportunities like the Classic Ambassador Program. I think it's all yours, Barb.
Okay, thanks, Becca. Well, I'm really so impressed. You guys are amazing. I feel like saying congratulations is totally inadequate because you're just so, you've taken so much initiative and done so much. But I do want to say, above all, I think thank you for the time and the effort that you put in, the dedication and the vision that you put into being climate ambassadors. I guess we all hope that you'll be continuing to bring your energy and your brilliance into the climate movement for years and years. It's probably pretty hard for some of you right now, especially if you're in the throes of a residency or you're in a new job at the start of your career, or you're trying to establish yourself while you keep learning. What I really wish is that I could hire all of you to work in PSR. That would be my dream. Unfortunately, we can't do that. So let me offer you one much more modest but easy way for y'all to stay connected to PSR and engaged on policy. PSR has another ambassador program. It was actually the original ambassador program, and it's made up of, for the most part, working health professionals. So your peers, but most of them over 35. We call them, to distinguish them from the next generation ambassadors, which is you all, we call them our classic ambassadors. The way it works is that we invite them to take an action, usually just once or twice a month, on key climate and energy issues. And these are not your run-of-the-mill press send kinds of action alert actions, but these are invitations to take more sophisticated actions. They could be things like writing an op-ed or testifying before the EPA or visiting Congress. Wait a minute, you guys have all done that, right? So you are trained and ready to go, and we'd love to have you join the this Climate Ambassadors, Classic Ambassadors program. For those of you who feel like you might be interested, but you might need some more training or some support, we will offer it. So you should also sign up to become climate ambassadors today. I'm going to put the a link. Well, I'm going to put up 2 links in the chat. One is just where you can learn a little bit more about the program, and then the other is where you can actually sign up to become an ambassador. So let me do that right now. There you go. So thank you. I hope you have the wind at your back, and onward.
Thanks so much, Barb. I just want to say 1 or 2 other things about that. This is definitely less of a time commitment than the Next Gen program, and a great way just to stay involved. If also you want to join the e-activist list, this is just going to be different action alerts, some similar to ones that I've sent out. But it is also another way to stay involved, and at least, you know, you can do an action alert if you have the time. And I know that Maya, who's here right now, will be coordinating some of these action alerts. So just a few different ways to stay involved. And then obviously I encourage you all to stay connected and continue on your individual advocacy. I know it can be overwhelming, different things to choose between, but it can be nice, as you've seen, to have the really short, the rapid actions, and also the longer community local projects. Yeah, thanks, Maya. So I think we can actually wrap up a few minutes early, give you a little bit of time back tonight. I just want to thank everyone. It's been so fun also to be among peers as well and be inspired myself. So I look forward to continuing to connect with you all in the future. So thanks, everyone. I hope you have a lovely evening. And I guess we'll say goodbye for now, but I'll be in touch with each of you individually regarding just the finishing steps and your certificates. All right. Thanks, everyone. Good night.
Thank you all.
Thank you.
Bye.
Bye.
Bye.